The Ebola outbreak has local hospitals constantly working to learn more about how to prepare for the worst.
But how much does the preparation actually cost? CBS 19's Risa Morris reports on the price hospitals pay to keep all of us safe.
Practicing putting this gear on and taking it off is a daily task for local hospital workers and EMS crews.
We'll continue to train. We'll continue to have our conference calls with our first responders. We'll continue to monitor both the CDC and DSHS and work with them and make sure that we have what's right and what's called for the citizens and our crews as well.
But all this extra preparation does cost money.
Well, you have the cost of training, you have the cost of paying people to come in and train and extra train and everything else. So yeah, this does have an effect on your budget.
Hospitals and EMS crews had to buy enough protective gear to outfit crews and make sure everyone who could be involved in treating a patient with Ebola is trained properly.
You have guys that have families and everything, and these guys have their scheduled days off, and now you're asking them not only to do their job at work, but you're also asking them to come in on days off and pay them to be there on days off to be able to do extra training.
But help may actually be on the way. There's a federal agency, it's called the Hospital Preparedness Program, and it works with other agencies to give money to hospitals during times of need, like this Ebola outbreak.
The Hospital Preparedness Program is funded annually. They have to submit a work plan. The hospitals have to complete the work, send back the receipts for the money spent, and then are reimbursed.
Work like buying extra protective suits and improving isolation rooms.
But right now, that money probably comes out of a general revenue fund, and with a hope of it being reimbursed later.
Though the hospitals do use extra money for outbreaks like this, the money is not taken away from normal hospital operations.
This is kind of what we do, and so this is not something that we decide we're going to stay home on. This is something that we're well prepared to go into and do what's asked of us.
Healthcare crews say they'll work to keep everyone safe, no matter how much money it takes. Risa Morris, CBS 19.
And Risa learned that if a hospital needs emergency funds, administrators can declare a state of emergency to get immediate funding from the government.
There has not been a state of emergency declared in the U.S. Now, there are a lot of rumors floating around right now because of the fear of Ebola spreading to East Texas. Health experts want you to know there is not and has not been a suspected case of Ebola here in East Texas. And if there is, NetHealth administrators will be the first ones notified by the hospitals, and they will give out the necessary information.
We work very diligently with our healthcare partners, our city, our county, our first responders, to make sure that we are prepared for an event of this case.